there's lots of caveats and maybes and all that, but we're maybe halfway to herd immunity at this point.
If people are following the CDC guidelines, we may not have the mutants take over.
Welcome to the RANE Insights on COVID-19 podcast. I'm Emily Donahue. There's a lot to talk about in this week's episode, from the availability of vaccines to staying safe. That means no big gatherings on Super Bowl Sunday. Let's listen as RANE founder David Lawrence speaks with Doctors Fred Southwick and Bill Lang.
Bill and Fred, once again, an honor. Let's bring the audience up to date with what's new with respect to COVID, vaccines, and recent data.
Well, one of the things I think is new is that the rates, the overall reported COVID disease rate is down 46% from the peak in early January to now. And so the big issue to me is that people are going to start seeing that, and they're going to start feeling like it's all over. And then what is the impact of these new strains? So I think that's a key issue.
Yeah, another exciting development was the Oxford AstraZeneca vaccine. They showed that 67% of the vaccinated did not carry the virus in their nose if exposed. So it looks as though we can actually prevent the spread of the vaccine will be effective at preventing carriers.
So Fred, let me unpack that a little bit, because I think very significant point, because it's one thing for someone to be personally protected from contracting the virus. It's another to say that by virtue of the vaccine, you won't be a carrier. Maybe you could just explain that development a little more for the audience.
Sure. All of the vaccines are directed, so far that have been released, are directed against the spike protein. And the spike protein is the protein responsible for binding to human cells and the ACE2 receptor. And they need to bind in order to get into the cells. The virus can only replicate when it is in cells. Therefore, if it can't get into cells, it can't grow and spread. And therefore, there's reason to believe that all the vaccines will have a similar effect. In other words, the virus will get into the nose. There will be antibodies directed against the spike protein. The virus will not be able to take hold. It won't be able to grow in those epithelial cells, the mucosal cells, and therefore no one will be able to spread the virus. So this is a very exciting development, and understanding how the virus causes disease, this would be predicted. So it's consistent with what you'd predict, understanding how the virus causes disease.
And there's obviously the public is focused, as you would understand, trying to figure out if they get the vaccine, if they're lucky enough to get the vaccine, which one should they get? And is there any advice you would give, to folks? And obviously, the Johnson & Johnson is hopefully under some expedited review by the FDA to bring their vaccine to market. But what advice would you give to the public?
I would advise them to get whatever vaccine is available. They all appear very efficacious, and so far all of them have 100% protection against severe disease and hospitalization, and that's what's most important. So whatever vaccine is available in your area, I would go for that one.
Yeah, and to put a point on that, perhaps the most important point of all this is not a single death due to COVID-19 has occurred in an immunized person, at least in the study groups. Now, when you start getting out to everybody who's received it, it's a little more difficult to track. But in over 150,000 people that have been in any studies, there has not been a single death, full stop. And that includes people, a fairly large group who were part of the study in South Africa, so would certainly have been part of the South African strain. And that has then been validated in real life in at least Israel, where Israel has well over 50% of the population has been vaccinated in Israel, and they have had no deaths from COVID vaccine. from COVID at all in Israel, in the population that has been vaccinated, with still a significant rate in the population that has not been vaccinated.
Yeah, Bill, I think that is incredibly exciting. And I can tell you that healthcare providers that have been dealing with these very ill patients, if they could, they would be out there vaccinating everyone, because they strongly feel that this is the answer to reducing the hospitalizations and eliminating deaths. So nothing could be more important than getting this vaccine administered to everyone in the United States.
All right, so just to put a fine point on this, your advice to everyone is don't pay attention to or even try to figure out one vaccine versus another. Get the vaccine. All have proven to be highly effective. And the good news coming out of this is that even with different strains emerging, that at the very, very least, this is preventing the most consequential impact of this virus, namely death or serious illness, hospitalizations, etc.
Yes, I agree.
All right. We are also seeing additional vaccines come on the market. As I mentioned, Johnson & Johnson. Also, there's a vaccine coming out of Russia, China. Any thoughts about this? And both of you have spoken about the importance of broadly herd immunity, but also the global and interconnected world, and the importance of getting vaccines out writ large to the entire world.
Well, I like the J&J because it's a single dose. And why that's very helpful from when you're working in the hospital, one of the things we would like to do, just as we have done for influenza and the pneumonia vaccine, we would like to discharge our patients with a vaccine to protect them against COVID-19. And the J&J will fulfill that role in that there doesn't have to be the logistics of a second booster shot. So from that standpoint, I think the J&J is going to be very helpful.
So, very quick review on it. We have the two of authorized vaccines in the United States, Pfizer and BioNTech, and then Moderna, the second one. Both of them are 2 shots, Pfizer 21 days apart, Moderna 28 days apart. Then the other authorized vaccine in other parts of the world is AstraZeneca. That's authorized in the UK and the EU. We probably won't see that in the United States, if at all, until April. And then we have Johnson & Johnson that is going to be going in for approval any day now, with approval likely probably the Thursday. It happens at the Thursday meeting of the advisory committee. That happens, so that would probably be not this coming Thursday, but probably the next Thursday at the earliest. Some people say it'll be the last Thursday of the month, but that's coming very closely. And the big thing with the Johnson & Johnson vaccine, in addition to just one dose, it's also refrigerator stable. So there's a really good argument to be made for using the Johnson & Johnson vaccine in difficult to access populations where you may have to send field workers out and they're not going to be carrying refrigerators on their back. And then the 5th vaccine that is probably coming down the pike fairly soon, especially in other parts of the world, is the Novavax vaccine. And that's also 2 shots, 21 days apart, has demonstrated very high efficacy in the UK, fair efficacy in South Africa for prevention of any disease. But that's going to probably be a little bit later, but that's coming pretty soon too.
Let me just get both of your views on the following. And this comes up time and time again in our working with businesses and concerns that their employees have. What side effects are you seeing from taking the vaccine, if any at all?
The major side effects we're seeing is a sore arm in some patients. Actually, I heard a description by one physician today who, during the second vaccine, felt sick for about 24 hours, and then miraculously it disappeared. And he said the side effects were slightly more severe than influenza, but not as bad as the shingles vaccine. So I think it's somewhere in between those two types of vaccine. there's a moderate but not serious side effects. And there have been very few serious side effects that have been reported.
Agree completely. And just, I mean, you never want to draw a conclusion from one person's experience, but I had exactly the same experience that your physician friend did when I got my second one. But I took Tylenol, and I kind of had aches and a little bit of feeling some chills the day after I got the vaccine, but I took Tylenol and I felt fine. And I've talked to many people who've had a very, very similar experience, although most people have had no complaints at all.
It turns out that usually younger people have more symptoms than older individuals. And there have been some low-grade fevers among the young and some more severe pain at the injection site in the young.
Not that this should be persuasive, but consistent to what you're reporting. I have a 94-year-old father-in-law in Florida who just got his second shot a couple of days ago, felt no side effects, and his biggest concerns is whether to take the Chiefs or Tampa Bay Buccaneers on Sunday, because he's going to lay some money down on that. Another topic that's coming up, I guess, on the emerging trend, because there has been a shortage of vaccines, is the question of whether a second dose could come from a different manufacturer. And I know it's under review, I think, in the UK, Fred, because that might be a very important development as well.
Well, they're all directed against the spike protein. So what the actual pathway by which that antigen is presented to immune cells probably doesn't make a big difference. So I would think from a theoretical standpoint that you could use two different vaccines for the two separate injections. But it would be nice to have that proved experimentally.
And there really shouldn't be any reason why you can't do it that way, because the vaccine centers, we don't want them stockpiling vaccine for a month until they have it. But the rate of flow of vaccines to vaccine centers is steadily increasing. So they should be able to plan out, all right, how many doses do I need to get second people, and so on and so forth. So I think that this is being able to do that second vaccine with the same one in the United States, at least, should not be a big issue.
One point of information which I think is important for the public to have is the view here that the FDA's involvement with the vaccines and the CDC's involvement sort of ends at the time that they approve a drug. And of course, that's not the case. Maybe both of you could shed some light for the audience about how there continues to be tracking by the FDA and the CDC, both in terms of efficacy and also to the extent that there are side effects and the kinds of data that they produce for various scientists to review.
Vaccines are actually handled very differently than typical medications. The vaccine adverse event reporting system lives with vaccines for their lifespan. There is always the obligation of providers to report into the VAERS system, and those reports do get reviewed at FDA forever. That doesn't happen with medications. So Fred, you're going to know better than I, but I don't think it is correct to say that the FDA drops out of the picture with vaccines once they're approved. And then, of course, the other issue is this has not been approved. This is strictly an emergency use authorization, and approval is going to come probably next year at the earliest.
Yes, I agree with Bill. The vaccines are monitored continually because different batches could have different side effects. And because the public is so concerned about vaccines and vaccine side effects, the FDA has been really monitored them very closely. And so I don't think there's any fear that they're going to drop away. They will continue to monitor the side effects of the vaccines and their efficacy. Remember, as we've alluded to, there are mutant strains. So far, at least from the standpoint of severe disease and death, they're all protective. But the South African one in particular which has 3 separate point mutations in the spike protein, probably has modified the vaccine or the antibody has a little bit more difficulty recognizing this mutant protein, because probably its conformation, it's how it's folded, is a little bit different, and therefore some of the points that the antibody would attack, it may not see. So that's the concern. If there are too many mutations within the spike protein, that could be potentially reduce the efficacy of any vaccine. As far as the UK mutant, that has only a single mutation in the spike protein, and there's every reason to believe that the efficacy for the vaccines will be the same as other strains.
As the vaccines are introduced into the market, there continues to be scientific and regulatory scrutiny around these things. So hopefully the public will have an even higher degree of confidence in the efficacy and the safety of these vaccines. And obviously, I know, Bill, you and Fred have done a fair amount of work in convincing people around the safety and the efficacy and disabusing people of the disinformation that's out there. Fred, you opened the door around the South African mutation, the UK mutation. Is there anything that people should be looking at or thinking about as a result of the data over the last week?
Well, in Florida, unfortunately, we have the largest number of the UK variant of any state. And that makes sense because our governor never mandated masks. So I think a fair number of people have not used masks. And when that happens, these mutants are more likely to spread. We're hoping that with this information, people will take notice and will begin using masks. The other exciting thing that I think has happened with regards to reducing spread is that because the Biden administration has mandated masks for all federal sites and for transportation, this now means that local mayors in Florida can actually mandate masks without the governor creating any penalties. And so actually just today in Gainesville, Florida, the mayor, the city council mandated a $150 fine for any bar or any restaurant where one of the patrons is not wearing a mask. I think this is very important. We talked about this before. There's a certain population that will resist all change, and it is only through mandates and accountability that we can convince them to wear masks.
Bill, I know you're always deep into the data, and you started this conversation by talking about the infection rate dropping. What are you seeing in terms of the mutation? Any concerns, particular hotspots around the country?
No, we're not seeing any right now. I mean, everywhere is basically down. The issue is it going to stay that way? And as Dr. Fauci has said, it's something of a race. You know, can we get a critical mass to immunity? And that's through a combination of both natural and induced immunity from vaccination. And so we can reduce the circulation of virus. And will immunity to the kind of the previous main virus, will that continue on? And to what extent will it continue on with the new variants? So that's going to be the big question. You know, so I think people should not get complacent that things are perfectly in the right direction, which they're doing right now, and just be a little bit concerned about what's going to happen in, you know, say the early to mid-March timeframe, and might things start picking up again. Especially, we start to get into mid-March. That's kind of spring break season for colleges, and people start moving outdoors again, and moving more into gatherings again. You know, get out of this period that we're in now, something of the hibernation period, And that could set the stage for things coming back again in mid-March. So we'll have to be watching that closely. But the good news is that now in the United States we have 32 million doses that have been administered. That's 8% of the population that have had at least one vaccination. We put that on top of, it's a little bit of a guess, but 30-ish% of the population that has been exposed to the virus naturally. So we're maybe halfway. There's lots of caveats and maybes and all that, but we're maybe halfway to herd immunity at this point. So we're getting there.
If people are following the CDC guidelines, we may not have the mutants take over. If the mutant, the UK, either one, both of them are about 80% increase in ability to spread. If they take over, we will see a huge surge, very much like was seen in southern England. So let's hope that and it is a race. If we can get enough people vaccinated, and I think one of the stories that's very interesting, Bill, you may know more about it, but I was reading that India has a very low incidence right now of the virus. And everybody is wondering, scratching their heads, what happened? And it turns out approximately 50%, they calculated about 50% of the people, and even higher percentages in some of the cities, have been infected, and therefore they are getting close to herd immunity there. So if we could get up another 30%, we might achieve at least early herd immunity.
Right. And one of the things I keep telling people is, remember, herd immunity is not a switch. When we say herd immunity is something like 70%, that you may think of that more as a pretty significant inflection point. As we start getting closer to herd immunity, the number of potentially susceptible people in society is going down. So the R value continues to go down. But when you hit that herd immunity threshold, that curve has an even steeper slope, and that's really what we're talking about. So it's not a switch that suddenly we're going to shut off all cases. It'll just be a differing slope in the calculated R value. Of interest, there are two internet viral things about vaccine that are going around. One of them I just laughed at the first time I heard it, but then I kept getting asked questions about it. One is that a concern that the vaccine may cause infertility in women. I have found nothing that supports that whatsoever. The second one, and this is the strange one, is that the viral comment is that if you have had the vaccine and therefore have immunity, you can pass it on to someone that you are intimate with. I've said, no, that is not true in any way, shape, or form. Not true.
In the remaining minutes, I'd like to pivot in, and I was actually with the client, and I was channeling both of you. We're coming up with one of the great gatherings of the year, the Super Bowl, where people are used to entertaining and getting together in groups. We have Valentine's Day, and as you already mentioned, Bill, spring break. But even if you've had the vaccine, or you're halfway through the vaccine, or you expect to get the vaccine, what are the precautions that people must continue to keep in mind? And I like to say we're in the 8th inning of this game, or the 7th inning, and we have a chance to build on the lead. Let's not blow it.
David, it feels a little like a broken record, but you have to continue to repeat that. If you're in a closed space around anyone that is not an immediate family member, you should be wearing a mask. And in any public area, you should be wearing a mask. You should maintain a 6-foot distance. You should not go to a location where there is a large number of people. And as far as the Super Bowl, you should not invite guests from outside your immediate family who have been together before, because the risk of someone carrying the virus, if they come into your house, and particularly when you sit in front of the TV and start cheering, guess what? Cheering and loud voice is the best way to produce aerosol and droplets there is. And you will, if someone is in your house that you don't know where they've been recently and they are infected, you will become infected. It's highly, highly likely. And wouldn't that be unfortunate when we're so close We don't want any more, as a physician, I don't want to see another person in the hospital on a respirator.
And then as far as, well, what does having the vaccine, how does that change your behavior? For now, it should not. I mean, I think that at some point we may get to where we have more data in addition to the AstraZeneca that is showing that the vaccine actually does decrease in infectivity. But for now, it should not change your behavior. The one thing that may change behaviors coming, who knows how soon, but down the road, is watching the cases, the incident rate, the cases per 100,000 per day. When that gets down to the low single digits, or ideally even less than 1, that's the point at which the community infection rate is relatively negligible. But I think that's probably what people should be looking at as a more controlling gauge of behaviors than whether or not you've been vaccinated.
Bill, I couldn't agree more, and I actually practiced that. I got the vaccine. I actually worked in the hospital for 2 weeks. I wore an N95 mask the entire time, and I never took it off except to eat, and I was kept at 10 to 15 feet apart from anyone else when I did eat. So I think it's really important at this point to practice the same way, the same behaviors that we did before, and not let up. Now in Florida, I checked the data. I remember about 3 months ago, we were very worried about 25 new cases per 100,000. In Florida, I think it's still at 60 per 100,000, 50 per 100,000. So we're not even close to even though it's decreased, it decreased from a very, very high level. So we're not out of the woods yet as far as new cases per 100,000.
So I want to thank you both for, again, some very, very clear insights, practical advice, and certainly one new takeaway is people should not fall for the pickup line that I've been vaccinated and I can help you.
So that's the most important thing to take out of this
It is.
podcast?
By the way, Bill, if people take away nothing else from this podcast, there are a lot of schemes that have arisen from the pandemic. People selling various cures and even investment schemes around this. So thank you both again, Bill and Fred. Always an honor.
Thank you, David.
Thank you, David.
Dr. Bill Lang is an expert in public health responses to biological incidents, including pandemics. Dr. Fred Southwick is an infectious disease specialist at the University of Florida College of Medicine. Individuals and organizations turn to RANE for risk intelligence that cuts through the hype to focus on what they need to know, what to expect, and what to do. You can sign up for our coronavirus solution to get critical information on the COVID-19 pandemic delivered daily to your inbox. Visit us at ranenetwork.com. That's RANE network.com. I'm Emily Donahue. Thanks for listening.